Hello everyone, welcome back again to Famjova's channel. So how are we today? First of all, I want to appreciate every one of you for always coming around to like, to comment and subscribe to my channel. Thank you guys so much for your love and for your support. If not for you, I won't be here, but here I am again to talk about another interesting topic. Now, in today's topic, we are not going to rush the topic. We are going to take our time so that everyone will follow up. So, in today's video, we'll be talking about hypertension and hypertensive drugs. Now, let's dive into the video. First of all, hypertension is the most common cardiovascular system condition. Now, when the pressure in your blood vessels rises, that should be a concern. When the pressure in your blood vessels is very high, it should be a concern. So, first of all, we are going to be categorizing blood pressure in their different categories. Now, when you get to a pharmacy and you want to have your blood pressure checked, a lot of us do not even understand what those numbers mean. They give you your result and you see another number up, you see another one down. Now, they mean two different things. The upper number means your systolic blood pressure, while the lower number means your diastolic blood pressure. Now, your systolic blood pressure measures the pressure in your arteries when the heart contracts. That's the upper number. While the lower number measures the pressure in your arteries when the heart relaxes. That's called diastolic. So the upper number will measure the pressure in your arteries when the heart beats or contracts, while the lower number will measure the pressure in your arteries when the heart relaxes. That's diastolic. So now, categorizing blood pressure in their different groups is actually simple. If you have your blood pressure 120, or let's say less than 120 to 120 over 80, that means you have a normal blood pressure. But in a situation where you have 130 over 90, that means you have an elevated blood pressure. Then in a situation where you have 140 over 90 millimeters of mercury, that means you have a stage 1 blood pressure. That means you have a high blood pressure in stage 1. But then when you have your systolic blood pressure above 140, let's say 180 over 120 millimeters of mercury, my darling, that's an emergency case. So these are the categories of blood pressure. So now, what are the things that you do that increase your risk of having blood pressure? Number one is age. Old age will actually lead to increase in your blood pressure. Then we have obesity, we have consumption of alcohol, we have stress, we have lack of exercise, and we have too much of salt in your diet. These are the things that you can do that can increase your risk of having blood pressure. Now, what are the risk factors? They are actually divided into two. We have the modifiable risk factors and the non-modifiable risk factors. Now, the modifiable risk factors are actually those unhealthy kind of things we do that we can easily get away with or do away with them. Let's put it the right way, we can do away with them. Like having too much of salt in your diet is a modifiable risk factor. Overweight is a modifiable risk factor. Stress is a modifiable risk factors. These are modifiable risk factors that you can actually do away with. But then the non-modifiable risk factors are things you cannot do away with, like family history of hypertension. That's family members that have history of hypertension. You can't do away with them. We have diabetes, we have genetics, we have old age. These are the non-modifiable risk factors. Now let's talk about the drugs, which is the main reason for this video. So first of all, antihypertensive drugs are actually classified into different classes. Now I'm going to be saying this slowly so every one of us can follow. Antihypertensive drugs are classified into different classes. Number one, we have the angiotensin converting enzyme inhibitors. Angiotensin converting enzyme inhibitors. Now, angiotensin converting enzyme inhibitors actually have drugs as lisinopril, enalapril, captopril. These drugs belongs to this class. They are angiotensin converting enzyme inhibitors. Now, what they do is it prevents the enzyme in your body from producing angiotensin 2. Now, this angiotensin 2 is actually a substance that will narrow your blood vessels. And then these ACEIs can also be used to treat heart failure as well as diabetic nephropathy. That's one important thing with antihypertensive drugs. They can actually be used to treat other conditions. Now, they are actually very effective and can be tolerated by a lot of people. But then they should be contraindicated in pregnant women because they may damage the fetal and neonatal blood pressure control as well as damage the renal function. So these ACEIs should be prevented in people that are pregnant. The number two class of drug we have here are the beta blockers. Now, beta blocker drugs, what they do is they actually prevent the release of adrenaline. They prevent the effects of adrenaline. Now, adrenaline is actually a hormone that your body produces when you feel frightened, when you're excited, when you're angry. That means adrenaline is released. So these beta blockers will prevent the effect of adrenaline. Now, they are also used to treat angina. Angina is actually a chest pain kind of condition that occurs due to reduced blood flow. So these beta blockers can be used to treat angina, but then they should be contraindicated in people that have asthma and then in people that have COPD, that's chronic obstructive pulmonary diseases. These beta blockers should be contraindicated in such people. Now, COPD means they are actually lung diseases disorder that causes obstruction of airflows from the lungs. So these beta blockers should be prevented from, should not be given to people that have COPD. Now, they are actually effective in all grades of hypertension. Beta blockers are effective in all grades of hypertension, and we have examples of beta blockers as atenolol, we have propranolol, we have labetalol, and a whole other lots of beta blockers. The number three class of drug we'll be talking about are the CNS drugs. Now, there are actually drugs that act on the central nervous system that are also effective in treating hypertension. We have methyldopa to be precise. Methyldopa is very effective in treating hypertension in pregnant women. So, some of these CNS drugs can also be used to treat hypertension. Then, another class of drug we have are the vasodilators. Now, the vasodilators are actually and what they do is they dilate, or should I say they open or widen the blood vessels. So when this happens, it helps blood to flow easily as well as then making your blood pressure to reduce. So the vasodilators are other classes of antihypertensive drugs, and we have examples such as hydralazine, and then we have sodium nitroprusside. Now, in pregnancy, there is something that occurs called preeclampsia or eclampsia. Now, this is a condition whereby there is high blood pressure disorder in pregnant women. So, for acute severe eclampsia, when it happens to such women, you give them intravenous hydralazine. It is safe for them when they have acute severe eclampsia. But then, in situations where you want to prevent eclamptic convulsions in these eclampsia patients, it is advisable to give them magnesium sulfate. So these drugs are actually effective for pregnant women when they have hypertension. Then another class of drug we have are the alpha adrenoceptor blockers. Now, examples of these alpha adrenoceptor blockers, we have the prazosin, we have the terazosin. Now, these drugs are actually used in combinations with other antihypertensive drugs, especially in conditions where the blood pressure is difficult to control. You can use these drugs with other antihypertensive drugs like the diuretics such as hydrochlorothiazide. You can combine them with the alpha adrenoceptor blockers to treat hypertension. Now, what they do is they prevent noradrenaline from tightening the muscles of the walls of the arteries. So when this happens, it leaves the blood vessels open and then the blood to flow easily as well as reducing your blood pressure. Then another class of drug we have are the adren and what's it called? Angiotensin receptor blockers. Now, angiotensin receptor blockers we have here are the losartan, we have the valsartan, we have the candesartan. These are actually examples of these angiotensin receptor blockers. Now, what they do is they actually help to relax the veins and the arteries, thereby making blood flow to making blood and pressure to be reduced. So they lower the blood pressure by relaxing the arteries and the veins. Now, another class of drugs we have are the diuretics. We can call this one water pills. Now, what diuretics do is they actually help the body. They help you get rid of extra salt and water contents from the body through the urine. Now, you can actually take them when you have mild hypertension, like hydrochlorothiazide that can be taken alone for mild hypertension. But in a situation where the hypertension is moderate to severe, you can combine them with other hypertensive drugs. So diuretics are other classes of hypertension. Then the last class of hypertensive drug we'll be talking about are the calcium channel blockers. Now, the calcium channel blockers, what they do is they prevent the calcium from entering the cells of the arteries and the heart. So these calcium channel blockers are actually important for treating hypertension. We have examples such as amlodipine, we have nifedipine. Now I'll be talking about nifedipine. Nifedipine is actually one of the powerful drugs that can be used to bring down hypertension in emergency cases. Now let's say okay, the hypertension value is around 180 over 120. That's an emergency case. Now all you need to do is give 10 milligrams of nifedipine. The person don't need to swallow it. Just put the drug sublingually. What I mean by that is putting it under your tongue. That's sublingually. You put the 10 milligram of nifedipine under the person's tongue. Let the person, it will dissolve there. He or she doesn't need water to swallow. That is why it is taken sublingually. You put it there, allow it to dissolve, and trust me, in less than 10 minutes, it will reduce that blood pressure. Now, these drugs are actually very important for treating blood pressure. And please, you need to do the right thing. Make sure you take care of your health. Make sure you reduce the intake of salt in your diet. Make sure you take lots of fruits and vegetables. And make sure you exercise in order to keep fit. Blood pressure cannot be cured, but it can be managed if you do the right thing. So if you like this video, comment, subscribe, and upload. Sorry, if you like this video, comment and subscribe to my channel so that when I upload another video, you'll be the first to know. Take care, guys. Take care. Bye bye.